Hi, I'm Flip Padot. Welcome to Old Bull TV, your insider's guide to political prediction markets. Now, as we record this, COVID-19 is wreaking havoc, not only on its hundreds of thousands of biological victims, but on the very viability of the global healthcare infrastructure, on financial markets, and of course on the daily routines of billions of people. So, could prediction markets help humanity to even the score? Can they help policymakers and the general public anticipate and respond more quickly and more effectively to unfolding emergencies like the coronavirus pandemic? Yes, but should they? Yes. Let's find out how and why. Let's shoot the bull. Well, prediction markets get a lot of buzz during election years, yes, but they do offer so much more. As real-time information markets, they can be highly useful during unfolding emergencies by synthesizing disparate sources of information which are often unreliable in isolation and yielding intelligence that can be crucial for policymakers and the public's decision-making. Political prediction markets like PredictIt, Augur, and the Iowa electronic markets allow individuals to put real money behind their forecasts of not only elections, but a wide range of political outcomes, offering up-to-the-minute insights on the evolving odds of, say, an embattled Supreme Court nominee being confirmed, or a trade agreement being signed, or of the government shutting down. Nearly any policy decision can be listed for legal and legitimate trading on such exchanges, so long as it can be unambiguously defined and measured. That's proven very useful for forecasting and managing political uncertainty, but the key strength of these markets, their real-time, decentralized aggregation of limitless bits of scattered, inconsistent, even contradictory bits of information into a quantitative signal, can also be a game changer in both our anticipation and mitigation of unforeseen and hugely complex societal emergencies. How valuable, for example, would it be for a hospital administrator to know how soon their next batch of testing kits will arrive? Or for a mayor or governor to know how many cases they'll have a week from now? How badly would the CDC like to know what the bug's actual mortality rate will settle out at? How useful it would be for financial institutions to know if the Federal Reserve is going to relax capital requirements? For airlines to know if and when a rescue package will be enacted? Or for families to know if and when financial assistance checks will go out? Take this to the next level. How useful would it be for policymakers to know what the actual economic impact will be, or what the healthcare impact will be 1 week, 1 month, or 1 year from now if they adopt policy A versus policy B? These and countless other uncertainties prevent optimal decision-making, costing time, money, and lives. And each of these uncertainties is a question that can be answered, at least in part, by aggregating the diffuse insights of medical device assemblers, research scientists, academics, nurses, economists, students, armchair epidemiologists, even real epidemiologists. And if their aggregate insights can help answer these questions, they'll enable more efficient allocation of scarce resources, preventing undue panic, think bank runs, hospital overcrowding, societal unrests, and ultimately save lives. So for the immediate crisis, how would we go about unleashing the power of prediction markets? What specific questions would we ask of those markets? Well, the possibilities are nearly endless, but right now the unknowns causing the biggest problems are: first, how to fight the bug biologically, i.e., which existing or in development therapeutics will be most effective at preventing, treating, or curing the disease. Here we could list markets asking whether the FDA or its foreign equivalents will eventually approve the use of chloroquine or some of the other promising treatments for COVID-19. We could ask about the timing and results of clinical trials of new therapeutics and vaccine candidates. Insights flowing from the scientific community participating in these markets, while not without some risk of perverse incentives to bid up a product in which one has an existing financial interest, could help prioritize and redirect resources toward the most promising candidates. Next would be the epidemiology and our medical capacity. So incomplete and inconsistent data pouring in from across the globe, at best messy and at worst deliberately censored and sanitized, has made it very difficult to reliably estimate the virus's reproduction and mortality rates, how and why they vary across regions based on demographic and lifestyle differences, and even how long it's been in circulation. That in turn makes it hard to forecast how many and how quickly people are likely to become sick. As a result, finite medical resources can't be efficiently allocated. If we had better forecasts of how many people require hospitalization in a given region, say in 2 weeks or 2 months' time, how many will require ventilators, how segregated they need to be from one another, and for how long, we would clearly be in a position to achieve better outcomes for more patients and to avoid overwhelming local healthcare systems. Likewise, we could ask about the timing and production and distribution of critical equipment, whether ventilators, masks, therapeutics, or even hospital ships. If frontline healthcare personnel can better anticipate when they'll have access to the equipment and drugs they need, they can make better informed decisions for their patients and their facilities. Clues to these unknown variables about the virus's spread and our medical response can be collected by these markets from healthcare providers, local government officials, anonymous whistleblowers in authoritarian regimes, and from patients themselves, particularly in the early days of an outbreak when formal data is the most incomplete. So the next really big category of unknowns that these markets can look at is the shape and timing of our public policy response. As we know, policymakers can be inscrutable and unpredictable in the best of times, and in times of crisis or even panic, particularly in an election year, policy uncertainty goes through the roof. With a stroke of a pen or an emergency vote, the federal government can reshape whole chunks of the economy almost without notice. Will the Fed drop $1 trillion from the sky? Will interest rates go negative? Will airlines get bailed out or be allowed to go bankrupt? Will foreclosures be suspended? Will Saudi Arabia and Russia continue their energy price war and crush the American shale oil industry? How long will schools stay closed? Will the president impose a mandatory nationwide shelter-in-place quarantine? The impact of these questions on every business and individual in the country is self-evident. And in not every case is there anything we could do about it, even if we knew the answer, or at least its probability in advance. But most of the time, forewarned is forearmed. If investors know an industry rescue package or loan guarantees for locked down companies are on the way, we can avoid undue stock volatility or even bankruptcies of otherwise sound companies, some of which in the transportation and energy sectors are part of the nation's critical infrastructure. Likewise, if small business owners know they're getting short-term tax relief or other temporary assistance, they may not have to lay off employees. And if a check for $1,000 from the government is going to arrive in 2 weeks, that might help a struggling and now out of work family make safer, more sound short-term budgeting decisions. Conversely, if these proposed aid packages aren't forthcoming, the sooner that's known by those affected, the better. So now these broad categories of unknowns, how the bug spreads, how it can be treated, how our healthcare apparatus is holding up, and what the policy response is going to be, are all areas addressable now by traditional binary options traded on political prediction markets. But there's also a twist on these markets that we can employ that could yield even more valuable and really unique insights. Here I'm talking about conditional markets, which ask traders to quantify some future measurement of public welfare under the assumption that a certain proposed policy is actually adopted, or that some other condition is met, like a particular candidate being elected. George Mason economics professor and prediction market pioneer Robin Hanson has long advocated conditional markets or decision markets as a means of formally advising government officials on their policy choices. Now, the formula here is pretty simple. If X happens, what are the odds that Y will happen? That could mean if we re-elect Donald Trump, will unemployment be higher a year from now? Or if we pass this tax cut, will GDP growth in the fourth quarter exceed 3%? Ordinarily, few politicians might be swayed by a market that deviated from their innate opinions on neatly partisan disagreements. But in a time of crisis, true crisis, when policymakers encounter often unprecedented challenges with far more blurred partisan battle lines, and when the stakes exceed their narrower political interests, these kind of markets may well ride to the rescue. So what kinds of policy proposals could we test with these markets? How about, what are the odds that an emergency interest rate cut would stave off a recession? And you can compare those odds with simultaneous markets on whether other Federal Reserve options like reducing banks' capital requirements or boosting repo lending would be more or less likely to achieve that same desired outcome of avoiding recession. Members of Congress could likewise avail themselves of the market's insight into whether a proposed stimulus package or a tax holiday will keep new jobless claims under a certain level, or whether an airline bailout would return the industry to normal capacity within X months, or, should they be so craven under more normalized circumstances, whether they'll find themselves in the majority or the minority of their chamber come January if they enact a particularly controversial piece of legislation. Likewise, we can ask whether some positive epidemiological or societal benchmark will have been met. Maybe whether public schools are reopened by the end of this school year, whether the Olympics goes ahead as scheduled, or whether total ICU bed occupancy has fallen below some specific level, on the condition that we adopt a specific policy or a specific basket of policies out of a range of options, like implementing a mandatory nationwide quarantine for 30 days, grounding all air travel, spiking the water supply with chloroquine, you name it. During crises, extreme measures are not only on the table, but sometimes defaulted to in an abundance of caution, given the sometimes asymmetric outcomes of under or overreacting. Certainly, it would be helpful for policymakers to have a better understanding of the likelihood of draconian remedies having their intended results. So, of course, all this begs the question of why we're not seeing contracts like these on markets like PredictIt and the other existing political prediction markets. And here, I think there are a couple of answers. First, the Dodd-Frank financial reforms directly disallow any markets tied to particularly dastardly things like assassination, acts of terrorism, war, and anything similarly contrary to the public interest. So anything approaching a death market is simply not an option if an exchange doesn't fancy the regulators slapping them down. A few years ago, it became clear that a market tied to the rate of Ebola cases would run afoul of these same prohibitions. So that may partially explain prediction markets socially distancing themselves from all things coronavirus. That said, PredictIt did have a market on whether the WHO would declare it a pandemic several weeks back, but nothing beyond that. Crypto prediction market Augur, which gets to kind of color outside the lines a little bit more, given that a decentralized market does not have a door for regulators to kick down, has said that it does plan to have coronavirus survival markets for the 2020 candidates. That's pretty darn morbid, but the bigger problem with those markets is not that they're morbid, but that they're more sensational than useful. After all, an argument can be made that trading on the contagion rate or mortality rate of COVID-19 is equally morbid to a direct death market. Even trading on the timing of an effective vaccine or whether a state's healthcare system gets overrun is effectively placing a bet on whether more or fewer people will die somewhere and over some period of time. What's more, some of the best information aggregated by such markets would necessarily come from folks on the front lines, the healthcare providers, administrators, support staffs, and researchers tasked with saving those lives. So isn't it monstrously unseemly for them to use their specialized knowledge about these matters to turn a profit? And to that, the 100% unequivocal answer is, of course not, with a small caveat. So maybe 99% unequivocal. If markets like the ones I've described can help medical professionals, policymakers, patients, and the general public to better defend themselves, not to mention the economy and society itself, against deadly threats, then we need to quickly and completely get over any instinct we have to recoil at deploying the tools of free markets and financial innovation to achieve that end. If a research team making quiet breakthroughs with some experimental new treatment can boost the signal of their progress through an efficient market's price signal, they deserve every penny for bringing it more swiftly to public attention. But now here's the caveat. With event markets like these, you can wind up with perverse incentives. And this is one of the reasons that the federal government smothered DARPA's much maligned policy analysis market in its cradle some years back, itself inspired by Robin Hanson's work in this field. That market was meant to yield insights into future terrorist acts, but among the criticisms was the notion that a bad actor could take a position in the market, in other words, bet on the location and timing of a future terrorist act, and then go commit the act in order to cash in on the bet. So markets that create perverse incentives do need to be avoided, or at least retooled in a way that cures the perversion. While Dodd-Frank ensures that any market under U.S. jurisdiction isn't going to list terrorism or assassination markets, you can still envision scenarios in which someone with the ability to influence a traded outcome's occurrence or timing, taking a position in a related market and then steering that outcome to their financial benefit. Now, you don't want a hospital administrator sticking healthy people in ICU beds just to goose their occupancy rates above some market benchmark, or a drug company slow rolling its trials by a few days to miss a market deadline. But happily, most of these cases are rendered trivial by the fairly low position limits imposed by the regulators on US-based prediction markets, at least those operating under the so-called no-action relief that PredictIt and Iowa electronic markets operate under. For the most part, the maximum market gains associated with a bad act of this sort would pale in comparison to the financial, reputational, and legal risks of committing that act. Still, this is the kind of edge case that has to be kept in mind and, when necessary, addressed either through very cautious rules drafting or, in rarer cases, even foregoing certain otherwise promising markets. That said, the potential societal benefits of these kinds of markets is simply enormous. They are absolutely the rightful province of prediction markets as they squarely address an academic research purpose, indeed almost by definition, crucial and intractable research purposes, and they would serve to improve policymaking and heighten civic engagement. And of course, they could quite literally save lives. I am hopeful that we'll be seeing markets like these in the very near future, so keep a close eye out. You're stuck at home anyway, so what else do you have to do? And we want to hear your thoughts on all of this, so please connect with us on Twitter at OldBullTV. And please remember to subscribe to this channel before you go. Thanks so much for watching. We will see you next time.